How's it going, guys? Pass level question for cardio for all the steps. We've got a the fuck am I saying? A 73-year-old woman who's got Mobitz 2, and we're going to do a pacemaker. Correct answer, choice F. Mobitz 2 and Mobitz 1, these are second degree heart blocks. Mobitz 2 is a problem with the His-Purkinje bundle. Mobitz 1 is a problem with the AV node. You're going to observe Mobitz 1, it's benign. You're going to do a pacemaker for Mobitz 2. It's dangerous. It can descend/degenerate into a third degree heart block, which can in turn degenerate into fatal arrhythmias. So you do pacemaker on USMLE for Mobitz 2 and third degree. You observe the others, basically always, okay? Mobitz 2, as we have here, we do not have a gradual prolongation of the PR interval. It's the same for these complexes, these first three. Then we have a dropped QRS complex. In contrast, Mobitz 1, we do have a gradual prolongation of the PR interval, and then we would have a dropped QRS. It's not hard, but it's what you gotta know. First degree heart block, you're gonna see a PR interval greater than 200 milliseconds. You'd basically have it as a diagnosis of exclusion, because it's not the first thing you necessarily look for. Okay, but you just see a massive PR segment, basically, a big distance between the P wave and the QRS for first degree. You observe, as I said. Third degree, pacemaker, as I mentioned. Two things you're going to look for, okay? Now, firstly, it's at the AV node, and it's a complete severance between the atria and the ventricles. You have asynchrony, so the atrial depolarization does not precede in a predictable fashion the ventricular depolarization. So the two things you look for in ECG. Number one, you're going to see a big distance between the QRS complexes. It's a ventricular escape rhythm, a heart rate of 30 to 40s. And you take 300 divided by the number of big boxes, that's your heart rate. So you look at an ECG, you see how these two complexes are super far apart. Obviously this is Mobitz 2, but I'm just giving you a point here. This is how all the QRSs will look, very fucking far apart when you have a third degree heart block and you're looking at the ECG. It's the first thing you'll notice. The second thing is no pattern between the P waves and the QRS complexes. Okay? Wolff-Parkinson-White, wrong fucking answer. So it's a reentrant tachycardia, and you're going to have a bundle of Kent. It's an accessory pathway. And the only thing you got to know is that you can get what's referred to as a delta wave, which is a shortened PR interval with a slurred upstroke of the QRS complex. We typically use medical management for it, like drugs like procainamide. It's fancy stuff. There's different types of WPW with different managements, but you could theoretically be aware that procainamide is a drug that has use case sometimes. WPW? Wrong fucking answer. You know the deal. When you make more content, I so screenshot. Appreciate your time. That's it.